case na she had throbbing headache talaga, then cramping pain. So we did a specific sequence, like sa neck, sa face, sa scalp, and then the abdomen. Like 1 hour later, nawala lahat ng pains niya.
Knock knock.
Who's there?
Re.
Rehu.
Rehabilitation and recovery is our topic for today here in the Strength and Movement podcast. I'm your host, Gab, and today we are with one of our doctors of physiotherapy and a specialist in recovery and rehabilitation. With me here is Dr. Pash.
Hello, Gab. Thank you for having me.
Thank you for being here. No, Doc Pash, you are with the Kinetics Plus team. Is that right?
Yes.
Yes. Talk about your background real quick. Introduce yourself to our audience and your experience here in the field.
Okay. I graduated in 2019. So I started working 2019 na rin. I started in a parang sports clinic siya. And then I found my way to polarity. So that's when I started my journey here with the same group basically. And then fast forward, nag-pandemic, I took my doctorate degree in University of Montana, so via FEU. So naging online na lang siya. I graduated again 2022 and here we are. Now I'm with the Kinetics Plus, working with the wellness facility, with the gym. And I am the PT supervisor then. So I supervise all of our physios na rin for all of our branches.
Mm. So you mentioned that you have been pursuing continuing education.
Yes.
You graduated from you took an online course to get your doctorate also. No? So for the longest time, I've had the notion that as a doc we like a doctor in a medical field, but it's more on the studies. Is that right?
If ever, yes, academically.
Academic.
Parang PhD siya.
PhD. Okay, great. Because like me, whenever I hear like doc, I would think na may stethoscope ka or ganon. But I mean, we have you here on the team, and it's good that you have all this knowledge to share with us. No, so we're in for a treat, and like we are currently running the Fit and Fierce campaign as our audiences have been who have been listening to the past two episodes. No, uh, we have covered coaching and training. We have covered nutrition. Basically, I think where we slot in recovery, yun yung third dun sa trifecta na yun, no? We are talking mainly with a female audience. We want them to be fit and fierce. We want them to be strong. We want them to be beautiful. Where does recovery fit in, or how can our female audience focus on recovery? Um, it's very broad, no? How do they, how can they approach and take recovery seriously enough so that they can reach their goal of changing their body recomposition?
Okay, so I'd like to start with like what physiotherapy is. So, yun nga, in general, there's a lot of fields. So, my geriatric, my pediatric, my sports, and my women's. So, specific field, yung women's. What we do here with the kinetics group is a lot of musculoskeletal and orthopedic conditions. So, if we would lean more into women's health, it's more about parang preventative recovery. Kasi we have preventative and then we have restorative. So for example, yung rehab mismo sa hospitals is for example stroke patients or traumatic brain injury patients. Basically, we get them back to their most optimum functionality. But there's another side of rehab or recovery, which is the uh, did I say restorative? Oh, sorry, preventative. The preventative side naman, kunyari you have muscle tightnesses, you have bad posture, you need a little bit of education here and there. So parang that's where we come in. So preventative is, I would say, really important also when it comes to your fitness. So parang yun, postural imbalances, we all have these. For women in general, depende yan. There's a lot of it depends. I will give you a scenario too. For example, some women have problems with back pain. So, kunyari, they gave birth, malaki yung tiyan, so they move into this pelvic tilting position na nawawala yung strength sa abdominals, and then nagta-tighten yung back muscles, nagta-tighten yung hamstrings, nagiging weak yung... So, something like that. So, we work with different angles, basically. So, we can do muscle building, a little bit of muscle building, a lot more of trying to relax all of the tight muscles. We can also do like lymphatic drainage. We can also do a little bit of recovery stretching. So there's a lot. Specifically for women naman also, women undergo their monthly cycles. So it might affect also sometimes yung ano nila, yung training nila. So actually, we have a program specifically designed for women during heavy days. We will do this type of therapy. On lighter days, deload days, we will do lymphatic drainage, something like that. So, proven naman siya na very helpful siya for women.
Oh.
Yeah.
So Doc, you have outlined many different approaches to recovery, and we'll go through them one by one later on.
Okay.
But one thing that stood out to me is yung postural imbalances. For our listeners who are not watching us on video right now, no, you mentioned something about pelvic tilt. Diba? Ako, I have a bit of knowledge naman when it comes to anatomy, diba? So when you talked about pelvic tilts and back pains, just to illustrate or paint a picture for our audiences, pelvic tilt is, for example, if you would imagine your pelvis or your hips, diba,
Yeah.
as a bucket of water. Would that be would that be fine? So if you spill the bucket forward, what is that, an
Parang
anterior?
yeah, just think of it as a baliktad na triangle.
Baliktad na triangle, yeah.
So yung flat part is nasa top.
Mm-hmm.
And then if you have like kunyari, tighter muscles at the back, everything moves forward, everything adjusts.
So it's spilling
So
forward.
yes, ang dami nangyayari. So nagiging anterior, pelvic tilting. We also have posterior.
That's
Pelvic
backwards
tilting,
naman.
yeah.
Oo. Okay. So something as little as that can cause pain, and that's something that our physiotherapists will be able to address. Kasi normally, even if just us sitting down here, pwedeng naka-anterior tilt to, and you would think na because naka-chest up, naka-good posture ka, pero if you look down, okay, di ba? Your back is sore na pala. So, yung mga little instances like this, not everyone can see it unless you have a trained eye. Diba?
Yes, yes.
So it's quite interesting to note. And then you mentioned something about, of course, for women audiences, having or being at different stages of their period or their ovulation cycle, magiging iba rin yung approach to recovery. Because
Yes.
there are women also who are, for example, if you're going to do manual therapy, is that right? Pagka
Yes.
pinindot mo, they're prone to bruising. Diba? So, mag-iiba-iba talaga siya.
Yeah, depends on kasi a lot of hormonal imbalances happen. So there's a phase in the cycle na very sensitive yung skin and yung muscles. And syempre, since may hormonal imbalances, emotions also medyo nagha-heighten. So I see some of our clients na disappointed when they can't do the lifts properly, or parang nabubuhat ko to before, ngayon bakit hindi? Or before, they used to love, like, for example, dry needling sa upper traps, tapos parang one day when we try and do dry needling naman, super sakit. Tapos umiiyak siya, bakit ang sakit? Ganito, ganyan. So we have to be careful then with what we do. So we have to approach it holistically. Holistically, yeah. So yung maganda is we work with the coaches kasi. So depende sa kung saan sila sa phase of their program, their coaching plan. Tapos dun kami mag-adjust dun. Tapos if if they see na, kunyari, they do lat pull downs, one arm is a bit more behind than the other, sasabihin nila agad sa atin. And then we might focus on that during the recovery sessions.
Right, right. Yung you mentioned something about yung dry needling. For our audiences who have not heard of dry needling, can you give us like a quick 30-second description of what it is and what it does?
Well, in basic terms, it's just westernized acupuncture.
Westernized acupuncture.
So we look for the muscle knots talaga mismo, the very strained muscle, naging thick siya. Tapos we try and target that one. So there are a lot of techniques also involved with that. Since internal siya, di ba, you have to puncture mismo the muscle, it can create micro tears. Kaya it can be painful for some. And then for yun nga, for women who have sensitive bodies, mas masakit siya.
Right. So depending on their pain tolerance
yeah.
also, so it
Yeah.
requires a lot of consultation and talking beforehand. Okay.
Yeah. So very important din yung assessment. So how they feel. So one type of recovery which we started to do was lymphatic drainage.
Okay.
That has been very successful
Sige, tell us more about this
so
one.
far. So basically, our lymphatic drainage helps detoxify. So tinatanggal talaga lahat ng toxins inside the body. For women in general, again, kunyari pag late yung period mo, kasi we get that a lot with the PCOS actually on the rise, we can actually help accelerate the removal basically. So mas mabibilis yung period nila. There are some cases, I've had this one case na she had a throbbing headache talaga, then cramping pain. So we did a specific sequence, like sa neck, sa face, sa scalp, and then the abdomen. Like 1 hour later, nawala lahat ng pains niya. So basically, di ba, what happens when women undergo their cycle? It's nagsished talaga yung endometrium nila. So that's what happens. So basically, nililinis nila yung uterus nila. So basically, nililinis yung katawan. So it helps speed up. It helps detoxify. It helps boost. So immune functions also improves for women. Actually for males also, pero yeah.
So highly recommended
Highly
siya
recommended
for
yung lymphatic drainage.
So that's one way to approach recovery.
Yeah, that's another way. So we have multiple ways. Tried and tested.
Tried and tested. When people hear about physiotherapy, I think their main insight on it is manual therapy when you start pressing on the muscles, releasing ganyan, no? How different is this from getting a massage?
Yeah, physiotherapy, kunyari, again, let's go back to the hospital setting. A patient suffered a stroke. Saan sila pupunta? Will they go to a physiotherapy who can restore everything back to their most optimal functionality, or a massage therapist? So basically, yun yung PT. It's mostly rehabilitative. So we get you to where you were before as best we can. Massage naman, in general, it helps with relaxation, maybe muscle circulation. Masarap siya. Masarap yung massage. But, does it get you back to what you used to do before? Diba? I highly doubt it.
Okay.
Pero it does help with
It does help.
muscle pains, muscle strains.
Soreness.
Pero, yeah, kunyari, na-fracture ka. We've had those types of clients. Oops.
Hands off yun. Yeah, because
Yeah.
I mean, for in Filipino culture, no, like you sprain automatic punta hilot
Yes.
hilot, diba? So it's very very different. You are you for or against hilot? Kasi in a way
Hilot.
it's ano it's a parang Eastern ano na yan, diba? Oo.
It helps naman. Pero specific audiences lang, specific people.
Specific people.
Yun, so parang if minor musculoskeletal problem, siguro baka makakatulong siya. But then again, you treat someone with a traumatic brain injury, that's another story. Hilot will not do anything.
it
Diba?
might worsen
It might
pa nga.
worsen the
Yeah,
symptom.
yeah. So again, um, I guess the key pointer here is to seek experts, no?
Yes, yes.
Experts in the field. Uh, of course, yung extent ng knowledge din ng
Mm-mm,
individual, I
mm-mm,
think important also there is yung assessment.
mm-mm.
We've had well in the recovery field also there's this thing we talked about massages, we talked
Mm-mm.
about helots. There's this one controversial thing and it
Yes.
starts with the letter C.
Okay.
Ends with a actic.
Okay.
What are your thoughts of getting a chiropractic adjustment when it comes to recovery? Is this something that we practice? Is this something that we recommend?
Chiropractitioners or chiropractic what
The practice, I guess.
it does help again, but again, specific audiences. Kunyari, you have a client with malunion. So, siguro yung joint niya was misaligned. Kunyari,
Mm.
had a fracture or had a dislocation, tas mali yung balik ng bone. They can help. They can help with that. So, you hear, di ba, like chiropractitioners, they like to pop all of the joints. Major joints, really, maybe it helps a bit in cavitations, pero yung minor joints, like the arm, the neck, sometimes it could be really
Pictures.
not really good. For
Risky.
example, sa neck, di ba, we have the vertebral artery. So,
Right, right.
pag mali yung neck adjustment mo, you might hit the artery, you might hit the spinal nerve, you might cause paralysis, and I'm sure you've seen the news. Parang maraming
There's
instances
there's one,
recently.
yeah, there's one online where uh a chiropractic quote unquote practitioner
Mm,
adjusted a gentleman in ano in his home practice and
ah,
ended up
yes,
putting the guy into the
unfortunately,
hospital. No?
yeah.
So again, like you said, if it involves the spine and the neck,
Mm-mm.
medyo dahan-dahan
Yeah,
dapat or
yeah.
parang
It
think
depends
about.
talaga. It
Oh,
depends. There's a lot of it depends. But I've seen chiropractitioners help people talaga with like spinal impingements, a little bit of slip disc also. They can help talaga.
mm,
But in general, acute lang siya. By acute, parang it means parang like it's not the end goal.
mm,
Maybe first 2, 3 weeks, maybe first month lang, pwede ka magpa-chiro.
mm.
Pwede ka magpa-adjust, joint play. After that, syempre, what brings the joints together, what stabilizes the joints together, is still your muscles, still your joints. Yeah, so it's still your ligaments, still your tendons. Maybe a little bit of exercises after helps.
In the realm of physiotherapy and in this specific
Mm.
instance, since we're talking about body recomposition,
Mm-mm.
we're focused on recovery. Uh, when you talk to our female clients or have their assessments, kasi sometimes, di ba, parang they would come to you na, okay, tight lang yung shoulders ko,
Mm.
doc, baka pwede natin i-therapy yan. Do you limit it to just parang adjusting or parang or taking care
Muscle
of muscle
problems,
problems
mga
now
ganun.
or do you like we've had si Coach Aki here and
Mm-mm.
si Ina and our approach is of course we have plans laid out for them for the long term.
Yes.
Do we have something that is similar when it comes to recovery, like a similar approach? Paano yung atake natin dito, Doc?
Approach sa women in
Approach to women, like for example, di ba, my shoulders tight. Okay, I have instant
I see,
relief.
I see, I
Does it
see.
stop there?
Gets. Yeah, depende sa problem ng client.
Mm,
So that's where we focus on. Pero what's important with our current rehab programs are preventative.
preventative.
Kasi since they're lifting, they're doing a lot of physical lift I mean exercising
Exercises.
has its physical demands naman talaga. So what do you do to recover? You can do active recovery or you can just come see us. Di ba? Kami na bahala. And just to add also, um, pelvic floor dysfunction, we've been hearing a lot about this. So in terms of our recovery here, we have specialized PTs talaga who specialize in pelvic floor dysfunctions. So very common siya in women with multiple births. Could be in older women also. You know, menopausal, naging menopausal sila. The pelvic floor basically, nagiging weaker siya or nasa-strain siya. Multiple live births, di ba? Sometimes hormonal imbalances also can cause that one. So, how do we assess and how do we treat people with women with pelvic floor problems? Usually, we leave it to the experts, our female physiotherapists na rin. Similarly, like males also get pelvic floor problems. So, basically, kami na bahala doon. So, female health, female PTs na as much as possible if kaya nila. Otherwise, yeah, in general naman, we can see everyone.
Right. So you've touched upon a topic about live births and pelvic floor weaknesses and ganyan, no? So if, for example, a client who's of course trying to get fit, ganyan, has the initial assessment about
Yes.
it. Doc, I have several kids na, and some siguro I think maybe some have done live births, the others naman siguro C-section, di ba? You can kaya mag-prescribe kung paano nila, you work hand in hand basically, is that right?
Yes.
With a coach
Yes.
to prescribe movements and exercises to bring them to ano.
Yeah. Again, depends kasi on their problems talaga. But, yun, for pelvic floor, we have specific rehab for that. For the cesareans naman, if you think about it, di ba? Kasi they open talaga the lower abdomen. So, essentially, kinakat talaga yung rectus abdominis, the muscle mismo.
Right.
So, when you stitch it back up, parang hindi na siya 100%, maybe 80, maybe 90% na lang siya. So, yeah, muscle activation, exercises really helps with that. Maybe a little bit of activating the obliques also. Basta yun, naging weaker na yung abs. Thus, you see more women talaga with that pelvic tilting problems that leads to the low back pain talaga. Tapos nagtatighten na yung quads nila. So, parang dami na nangyayari. Dami ng compensations na nangyayari. Especially for women, actually.
So it's the initial assessment
Yeah, the
that allows you
assessment's
to
very,
plan it out.
very important. Parang we can see like where we're lacking, where they are lacking, where we can improve, what we can focus on, basically.
And I think that will that gives a better plan, a better roadmap for clients and trainees,
Yes,
you know, for them to achieve their goals. Kasi I think they would come to the gym para, okay, yeah, let's push hard, ganyan, ganyan, ganyan. And then you ask them, teka lang ma'am, what's your history ba? And then nagsisilabasan yan. So part of your job or part of your tasks also is to put things into perspective for them.
Yes.
Basically, oh, teka lang, madam.
Yes.
Let's slow down a little bit. Let's work on your weaknesses first. And that's where your services and your expertise comes in then.
Yeah, that's why assessments talaga are very important. We have this thing called the motion scale. We assess the body from top to bottom talaga. We assess the upper extremities, the lower extremities, the spine, and then the hips. So marami tayong makikita from there pala. Tapos yun, for example, again, you have a client na diabetic siya or may hypertension. Tapos you're gonna lift heavy weights. Oh, what will be the conclusion of that? Baka mahimatay pa yung client, no, after heavy lifts. Kaya assessments, really, really important. We do comprehensive assessments talaga. And then, based on the assessment, we plan the treatments. So, this is if my rehab, basically may problem yung client. If wala naman, preventative. So, the minor discrepancies in their bodies, we focus on that naman. So, kunyari, I have had a client with persistent yung pain niya sa hamstring. Never goes, she does Olympic lifting. It took us some time, pero nawala yung pain niya completely. So, after that, she went on to win multiple competitions, di ba? Kasi pain-free na siya. She doesn't have to think about that pain. So, that's how important preventative recovery can be. Di ba? Make or break.
Make or break it. No? I mean, she won medals for this, for her tournaments. No? So it's very difficult also kasi For people who have never asked for or subscribed to a service of a physiotherapist, like me, for example, before I would just Google knee pain, di ba? Ganyan, tapos magsa-self, ano na yan,
Yeah.
foam rolling,
Yeah, yeah,
ganyan,
yeah.
stretching, and thinking na, okay, sige, should be fine, and then babalik na naman.
Mm-mm.
So, without that knowledge, that expertise, maybe, yun nga, di ba? It must be stemming from something else.
Yes,
Oo.
yes. Yun lang. Parang for example, di ba, you've had knee pains.
Mhm.
What if hindi sa knee galing yung problem? Di ba? What if it was the gluteus medius, for example? What if it was coming from your ankles?
Yun nga. So,
Kaya comprehensive talaga yung assessment. We find where, kung saan talaga yung origin.
so hindi dahil yung tuhod yung masakit, nandun yung problem.
Yes,
It
exactly.
might be somewhere
Might be
else.
somewhere else.
And hindi natin malalaman yan and hindi ko malalaman yan, for example, kasi I don't have the expertise, diba? So it's very important, and we thank you for learning these things so that you can help us move without pain and continue to train to hit our goals. I have another question here for you, no?
Yes.
Can physiotherapy be beneficial even for individuals without injuries, and how can one stay injury free?
Saying injury-free is possible naman. Pero yun, going back to what I said before, preventative na yung ginagawa natin. So, kunyari, ang daming problems with tightness. We focus on mobility. We have lethargic clients. Alam mo yung nagbubuhat ka pero nagyoyon sila in the middle of the session. Bakit kaya?
Bakit nga ba?
Again, it depends. But yung nanonotice ko based on our clients is, syempre, there are a lot of high-performing individuals, stressful individuals here. So maybe not enough yung sleep nila, not enough yung recovery. That's where lymphatic drainage comes in. Diba? So it could be muscle activation, could be mobility, lot of factors, and then we adjust based on the factors.
Galing. And with a scientific approach.
Yes, definitely. Evidence-based approach talaga yung, syempre, we're in the medical field. We have to be continuously, we have to know basically what's happening currently. Kaya highly evidence-based kami in
Great.
terms of treatment.
For our female audiences
Yes.
who have been injury free, who have been diligent in their training, who have never been injured nga in their lifetimes, no? Will there be any opportunity or any reason for them to consult you? Just pwede bang, I mean, they're healthy, they're ganyan. Is there a need for physiotherapists if, for example, you are already, okay, I've never been hurt, my lifts are going up, everything is all fine and dandy. Where do you come in?
Yun. If ever, everyone feels they're very healthy until we do the assessment. The assessment talaga you
It
find
reveals
something.
it.
Pero, perchance if may tao na pasado sa lahat, joints no problem, strength no problem, then yeah, there might be no need. But then there are other forms of recovery. We can do active recovery, we can do lymphatic drainage, we can do some sort of stretching. There's always something. So the assessments start before your journey. Or basically, is that the start of the journey na?
Part of the journey, speaking of. Okay, and ito, I've been asking the previous guests here. So, in your field and with your understanding, how does one become fit and fierce? Where does recovery play? At what point does recovery play a part in achieving a fit and fierce physique or a body or a state of mind?
I like what Coach Iggy said, actually. It's how you perceive yourself talaga. Kasi recovery, let's face it, important siya. Your body goes through wear and tears talaga. So what do? Do you lift more, or do you do the activities that breaks your body, or do you try and recover? Recovery is as simple as sleep, 'di ba? So, siguro for us to have a fit and fierce approach to life, recovery wise, mentally and physically, one should be, uh, how do I put it? Parang mentally okay, physically okay din siya. Um, it's your perception talaga. It's like how you see yourself. That plays a very big role. If you know you're not okay, reach out to us, 'di ba? We're therapists, so we can help you. Also, if you have problems, you can reach out to us. Plus, we have patient-client confidentiality, so nothing goes outside the rooms. So yun, just to put it simply, if you believe you can look fit and fierce, you can be fit and fierce. You can. No one is stopping you.
Beautifully said, Doc Pash. No? Thank you. So we have a lot of things to cover here, and I would love to extend our time, but unfortunately, we are beyond. Thank you very much, Doc Pash, for
Thank you.
being here
Thank
on
you,
the
Bill.
Strength and Movement podcast. And for our audience, stay tuned for more. You are listening to the Strength and Movement podcast, and we will be back soon. Thank you very much.